Hi, my name is Dr. Olivares. I'm going to teach you today how to set up your Rebuilder medical device to retrain your nerves for neuropathy. So with your device, you're going to get a foot bath. You're also going to get a kit that contains your Rebuilder. It also will have your electrodes in there. You'll have a set of rubber pads, some stickers for the dry method, and I'll explain these methods in a moment, and a set of leads. You'll also get some electrolyte spray. You'll get 4 of these. I'm here with Dr. Suhyun An. She's going to be my patient example today as I set up the Rebuilder therapy. So what you're going to do is you're going to take your foot bath. This is the wet method. You're going to take your foot bath. You're going to fill it up with water about ankle high or just enough to cover your foot. There's a convenient ledge inside of your basin here that you can fill the water to, but you just want to make sure your feet are submerged. So I'll have you put both of your feet in the water. Now, I'm going to take my electrolyte spray, and on either side, I'm going to give it about 20 sprays. Or about a tablespoon or a teaspoon. Okay, and then if I could just have you move your feet around to kind of shake that around. Now, in your yellow bag inside of your case, you should have found 2 rubber pads. These rubber pads are the pads that you will use for the wet method. They'll be placed onto the ends of your leads, like so, and dropped into either side of the water. Then the other side will be plugged into the top of the Rebuilder. Okay? And from here, all we do is turn the Rebuilder on. So when you're turning this on, you want to make sure that you don't go really fast, because some people are going to experience the sensation immediately, and some people might not experience it at all. It might take a little bit of time to get used to it. So what you're going to do, if you have someone helping you maybe too, you're going to turn it up. You want it to be strong, but still comfortable. So I'm going to turn this up. Tell me when you feel it first.
Feeling now.
Okay. Now I'm going to keep turning it up. Tell me when to stop. Strong but comfortable.
Now.
Okay. And would you briefly describe what it feels like whenever it's working?
It feels like tingling. Just mild enough tingling. Nothing shocking. I do feel it all around my feet, but then I don't have neuropathy, so but it feels very pleasant. Yeah,
right. And some people will also feel this up their legs a little bit, particularly with the wet method. So if you're able to do the wet method, this is something that we prefer over the other method, which I'll show here in just a moment, because you'll get the whole entire effect versus the other method may be a little bit more focal. So you want to do this for 1 to 2 times a day. 2 times is what we're aiming for, but 1 time minimum for 20 minutes. So for the Rebuilder dry method, all you need is the set of sticky pads that come in this package and your Rebuilder. Okay? You'll plug in 2 of the leads into 2 of the sticky pads, and you'll plug them on. You'll put them on straight where your symptoms go. So, Dr. An, where are your neuropathy symptoms on your feet, if you had them?
Mostly on the bottom of my feet.
Okay, so go ahead and raise your foot for me. I'm going to put one right here and then right here. Okay? And then what I'll do is I will turn up the Rebuilder until you feel it, and then we will turn it up until it's strong but comfortable.
I feel it now.
Okay, can I keep going?
Yes.
Tell me when.
Now.
Describe what it feels like.
Tingly.
Okay.
mildly tingly, pleasant. I wouldn't describe it anything unpleasant or shocking or anything like that.
Okay.
Yeah, like getting a tiny little bubble massages.
Okay.
Yeah.
So with the dry method of the rebuilder, the only downside to the dry method is that you're only going to feel it where the pads are placed. So if you have some neuropathy symptoms in your upper leg, you may not feel some of the tingling sensation that you're getting from this machine in the other parts of your leg. You're just gonna feel it where the pads are. But this is great for travel, so you don't have an excuse if you can't get the therapy done. Or if you need to take it to the office, or if the wet bath is not convenient for you.